Hello, and welcome to Meningococcal Prevention, Real Stories, Questions, and Impact. This session was developed by Vindico Medical Education with educational grant support from Sanofi. More project information can be viewed in the link in the comments. My name is Christine Burke. Many of you know me as the keeper of the Fruit Loops, and as many of you also know, I have two college-age kids, and I am honored to be here for this very important conversation. My daughter had viral meningitis when she was very little. So when it came time to send our kids off to college, meningitis was at one of the very first conversations I had with our healthcare providers, because as you know, sending your kid off to the dorm, you want to make sure that they are as protected as possible. And so I'm really thrilled to be able to have this conversation so that parents can understand the importance of meningococcal prevention and really learn about what they can do to be proactive. Today, I'm joined by two very special guests, and I'm hoping they'll introduce themselves. Dr. Vega, do you want to go first?
Sure. My name is Chuck Vega, and I'm a clinical professor of family medicine at the University of California, Irvine, where I'm also an assistant dean of the School of Medicine. I work in a federally qualified health center. We're the biggest safe net clinic here in our county.
And we are also joined by Patty Wukovitz. Can you tell us a little bit about yourself?
I'm Patty Wukovitz. I'm a registered nurse from New York, and I'm also the co-founder of the American Society for Meningitis Prevention.
Well, welcome. Thank you both for taking the time to have this conversation with me. Why don't we just dive in? Patty, this question is for you. Could you share your personal experience with meningitis and the vaccine?
In 2012, my daughter Kimberly was a healthy high school senior in her last 2 weeks of school, looking forward to the next week where she would go to her prom and she would have her high school graduation and then begin her nursing education. Kimberly's dream was to be a pediatric nurse.
Mm.
She came home from school one afternoon and complained that she had body aches and a low-grade fever. So I gave her some ibuprofen, and she was absolutely fine after that throughout the rest of the night. However, when we woke up the next morning, Kimberly was very sick. It was drastically different. She said, "Mommy, everything's hurting me from the top of my head to the bottom of my toes. Even my eyelashes hurt."
Oh.
And then she couldn't lift her head off the pillow. She was really, really sick. And she said, Mom, I feel like my ankles are bleeding. So I pulled back the sheets and I saw that she had tiny purple dots on her ankles. And as a nurse, I knew this was very significant, and I rushed her to the emergency room. Once we got to the emergency room, the doctors pulled me aside and they said, "We suspect your daughter has bacterial meningitis and that the bacteria has actually infected her blood." My reaction was, there's no way my daughter could have bacterial meningitis. She's been vaccinated. I know for a fact that she received the MenACWY vaccine at 11 and a booster dose at 16. The doctor then went on to tell me that although Kimberly had been vaccinated with the MenACWY vaccine, she was left unprotected against another serogroup of bacterial meningitis called serogroup B. At that time, we did not have a vaccine in the United States licensed to protect against meningitis B. So at that point, I had done everything that I could have done for my daughter.
Of course.
She was as protected as she could have been at that time. Things went downhill very, very quickly for Kimberly. She was septic. She was in multi-organ failure. She was losing blood flow to her limbs. Her limbs had turned black. They told me that if she survives this, she will likely be a quadruple amputee. And shortly thereafter, it was also determined that she was losing blood flow to her brain and that I had to make the most horrific decision of my life. And that was to remove my otherwise healthy, beautiful 17-year-old from life support. I buried Kimberly in the prom dress that she had hanging on her closet door. It's all ready to be danced in. Her shoes are right there. She was a 17-year-old who was full of life, and she had so much more life to live. And she was like any other healthy high school senior.
Oh, Patty. That is an excruciating story, and I am so sorry for everything that you have gone through. And I have profound gratitude that you're here to talk to us and parents like me who want to protect their child and who think that they are already doing everything that they can, and to learn more about how we can protect our kids against meningitis. And I know as a mother and as a nurse myself, I can't even begin to imagine how you've been coping and how you were able to get through that situation. Um, in an awkward segue, Dr. Vega, could you explain to us a little bit what exactly is meningitis and how can it make a healthy teenager seriously sick? And how can it happen so quickly?
Right. Yeah. So I just want to also voice, Patty, my condolences on everything that's happened, and just really appreciate your strength and your power and in getting through that. And now, being an advocate so we can affect change to reduce the impact of really what is absolutely, you're right. It's a terrible disease with a mortality rate of 10 to 15%. And that's with treatment. So it's very serious. What it boils down to is inflammation of the meninges, which is the lining of your brain and your spinal cord. Unfortunately, it's a very rich area for either a virus or a bacteria to grow. And it doesn't, it's also fairly protected from your immune system. There's a blood-brain barrier. And so once you are infected with meningitis, the risk of mortality, the risk of disability, even if you are fortunate enough to survive bacterial meningitis, it's fairly high. And so it's one of these very serious infections that absolutely comes on very quickly, can present non-specifically like a flu-like syndrome. But very importantly, the reason I think we're all here is because we can prevent it. We have driven down the rates of bacterial meningitis substantially thanks to the use of the meningococcal vaccine. And so we just have to, keep moving that ball forward and protect more kids like Kimberly.
Dr. Vega, before we get into talking about the vaccine itself, could you give us a quick bullet list of warning signs that parents should look out for that might mean their child has meningitis, and how quickly do these symptoms escalate?
Right. So it is challenging at first. And so, even as a clinician, I wouldn't necessarily, beat myself up for someone, who comes in like, well, they're feeling a little down and they have, some mild fever and some runny nose. We're going to think that's a viral infection because 98% of the time we are going to be absolutely correct in that. And so we don't want to, necessarily overreact. But watch if it's whether it's a child or an older adult, watch them closely. And if you notice the fever is going higher, if they're developing severe headaches, if they start having symptoms like vision changes or they are getting confused, they're having a lot of back pain, neck pain. It's really hard to move their neck. It's getting stiff. Try to think about these things and be proactive. Get them into a clinic sooner rather than later, because really at that point, every hour certainly counts.
It sounds like parent instinct. I know when my daughter was sick, she was very small and it was just something was off and that fever. And I called thinking it was just a cold. And they said, oh, no, get right to the emergency room. And I think to Patty's point, like you just know as a parent, something's wrong and maybe to, trust your gut and get health care to your kid quickly rather than wait.
Right.
Yeah, you are the expert in your child. So yeah, absolutely. I respect that quite a lot.
Yeah.
When the doctor in the emergency room told me that, she suspected Kimberly had meningitis B, I said, oh my God, what if I had brought her to the emergency room last night when she had body aches and a fever? She said, we would have sent her home.
Mm-hmm.
We wouldn't have suspected meningitis at that time because it does have vague symptoms at the onset.
And the only reason we were sent to the emergency room was because she was so little. It was within the first month of life. So that was a fever of unknown origin. So that was the only reason that it was taken a little bit more seriously. But you're right. In a little older, she would have just been, same thing. Okay. So now that we've talked a little bit about the symptoms and the warning signs, let's talk a little bit about the vaccines. And there are several meningitis vaccines. Which ones do kids and teens need?
So at 11 to 12, children are recommended to get the MenACWY vaccine. First, I will want to just clarify that for meningococcal meningitis, there are 5 most common serogroups that will likely cause meningococcal meningitis. And those serogroups are A, B, C, W, and Y. So at 11 to 12, you get a MenACWY vaccine. And then at 16, you get a very important booster dose for MenACWY. Now that meningitis B vaccines are available in the US, that's when the child will start their meningitis B vaccination series. So at that 16-year-old visit, they'll get their booster dose of MenACWY, and then preferably in the other arm, they'll start their meningitis B vaccination series and come back 6 months later to get their meningitis B second vaccine to complete the series. We also now have a pentavalent vaccine, which covers all 5 serogroups, covers men A, B, C, W, and Y. And that's 1 shot, and that could be given at that 16-year-old visit. Instead of getting 2 shots, one in one arm, one in the other, who doesn't want to get one less shot? You can then get,
especially teenagers.
Of course, you can then get the pentavalent vaccine in one arm and just make sure you go back 6 months later to get the separate meningitis B vaccine to complete it.
Dr. Vega, what misconceptions or worries do you encounter most from parents and caregivers about the meningitis vaccines? And how do you address these concerns with parents?
I think I hear a lot of the same concerns I do for vaccines in general. Like is it safe? Are we giving too much vaccine to my child? Because we're giving this vaccine around the time we're thinking about giving the HPV vaccine. Maybe they're due for certainly every year they should be getting a flu vaccine, considering a COVID vaccine. And it seems like a lot for parents. But just one thing I tell them is that while we certainly have more vaccines available, including meningitis, which we didn't have, 20 years ago, certainly, that's just more protection. So the reason we give vaccines, this is, this ounce of prevention, which is associated with a sore arm, and more rarely you can feel a little tired, but that usually goes away in a day. Treat it easily with acetaminophen or an anti-inflammatory drug if you need it. The benefit is that you can prevent these terrible illnesses. So, and in addition, while we have an expansion in the number of vaccines, the actual products you're getting in those vaccines is much fewer, because we used to, before the vaccinologists really worked on the technology with preserving the vaccine and making it stronger. Now we've taken a lot of those chemicals out. We've taken a lot of those adjuvants out. So you're actually getting a much more purified product that has been proven in technology and tested in thousands and thousands of individuals and proven to be safe. So that's one thing is, yes, it is. Nobody likes a shot, as you said. But the point is that we have these sporadic cases in otherwise healthy kids. These are healthy kids who get terrible sequelae of meningitis, and it is a preventable condition.
I know for me, meningitis was on my radar just because of our experience when she was little, our daughter was little. And as soon as our doctor started, he mentioned it to me, I was like, yep, we're on board. Like we've been there, done that in some capacity. So that conversation was rather easy for me to have with my healthcare provider. But either Patty or Dr. Vega, either one, this question is, what questions should parents ask their child's doctor or nurse to make sure that their child is fully protected?
They should specifically ask, has my child received both meningococcal meningitis vaccines, the one that protects against ACW and Y and the one that protects against B? Because without adding a meningitis B vaccine, they are not as protected as possible. And I live that and I know it. And I know the devastating consequences. I would like to just talk about another misconception.
Sure.
Another is that parents believe that since their child received the MenACWY vaccine due to their state's school and or college requirements, that they are as fully protected as possible, when in fact it's very likely that they didn't receive the meningitis B vaccine.
Mm-hmm.
Since 2011, all of our college outbreaks have been because of meningitis B. So parents think they fulfilled this requirement and think that they're done. But really, if they haven't received a meningitis B vaccine, they are not as fully protected as they possibly can be. And it's not just a college disease. My
Right.
daughter Kimberly was 17 years old, living at home with me, not living in a dormitory setting. Yes, we know that college students are 5 times more likely to contract meningococcal meningitis than non-college students. However, 16 to 23-year-olds are the ones who are at highest risk.
That is really good information. And it's a very good point about, making sure that you're asking all the, is my kid maximally protected against meningitis? Where should parents look for more information about the disease and how to protect their children?
They can go to the website for the American Society for Meningitis Prevention, which is meningitisprevention.org, as well as the CDC.
And I would just have a conversation with your clinician. This is really, so you want to try to be proactive. I know it's confusing, this ABCWY.
Right.
You can't choose like which serogroups are going to become the most prevalent, but those are the most prevalent. I know it doesn't seem to make a lot of sense, and it is confusing. So yeah, educate yourself at these valued sites that are trusted, and then ask questions. Maybe make a list when you go in and include meningitis on that list. Even if you just ask about meningitis in general, it's going to trigger a clinician to hopefully think about, gosh, have we been able to maximally vaccinate this patient? And if not, then there's a shared decision-making process between you and your clinician.
And it sounds like the conversation should start much earlier than high school, because I think, Patty, you mentioned the first round is 11 to 12. So this is also good information for parents of tweens, that this journey starts way before the kids walk into the college dorm room and way before they walk into the halls of high school. So this is an important conversation for parents of slightly younger children too.
Absolutely.
Yeah, certainly. We want to, there's reasons in place to protect children starting at age 11 to 12, because, we can get it. We have seen meningococcal meningitis and meningococcal disease in that age group. So that's when we initiate treatment. And then you want to get that booster dose after 16 to make sure they're fully protected.
Well, thank you, Dr. Vega and Patty, for joining us, and to the audience for tuning in. Patty, is there anything else you'd like to say to us, or any closing remarks that you'd like to tell our audience? Anything special you'd like to tell us about Kimberly?
Goodness, I could go on and on about Kimberly. Yeah, she was just this great kid. She was popular. She was, her friends would go to her as the voice of reason. She was a dancer. She was a singer. She would just grab a microphone and just sing and slide into the kitchen with her socks. She just loved to perform, and she was really good.
Oh.
And what I would say, though, to parents is don't take the chance. Don't take the chance of not having your child as fully protected against meningococcal meningitis as possible. I would give anything to have my daughter back. There's not a minute that goes by that I don't think of her. So please, please have the conversation with your healthcare provider.
Oh. Well, thank you again, Patty and Dr. Vega. And I am very honored to have been part of this conversation. And I thank you for your time. And I hope that parents that have tuned in will head to the websites that we've mentioned, and that you will click for further information about meningitis prevention in the comments. Thanks, everyone.
Thank you.
Thank you.
Be well, everyone.